Following segment sponsored by Erwin Health Care Center.
Well, we are spending some time here this morning here at Erwin Health Care Center, of course, right here in Erwin. Beautiful mountain views. We're here with their administrator this morning. We have Jason Bennett here with us. And Jason, thanks for having us out.
Well, thank you for coming. I appreciate it.
It's nice to get to kind of walk through and see some of your residents, and really a special place, and has been for a lot of years here in Erwin.
Absolutely. You know, Erwin Healthcare opened up in 1984. And we were the first in East Tennessee with a secure dementia unit. My staff have been trained over decades to deal with individuals who are suffering from dementia. Dementia, unfortunately, brings along a lot of behaviors that aren't accepted in general society. And so here at Erwin, we provide an environment and a community where they can feel comfortable to be who they are and how they are. At any stage in the dementia process. We just opened up a whole wing of private rooms, which is much more focused on a hotel-like environment. We provide an area where they can have separate dining. They have all the amenities of a hotel, such as we have Wi-Fi, we have 65-inch flat screen televisions, electric beds. The rooms are large enough. They were originally built for 3 residents, and so we took part of the room and made it into a family sitting area so that family members can come and relax and enjoy visiting. Nobody has to fight over a chair or sit on the bed. We have, it's a living room set really, in the room with the residents. 2 weekends ago we had a big car show, and I have a little 2-seater BMW convertible.
Ooh, fun.
Yeah, it's 22 years old. It's going to be a classic in about 3 years. But and some of the residents were like, "Hey, I'd like to take a spin," and it's like, "Sure, you can't drive, but I'll take you on a little loop." And so I took them down on the highway. We're looking to put together an Oktoberfest for next month. I want to have a polka band. I want to have kegs of non-alcoholic beverages so that it doesn't interfere with any medication.
Good idea, but you said, you know, just having that nostalgic moment.
Oh, absolutely. I want to have, you know, chilled mugs that you can walk up and pull the stein and fill it up and take a couple swigs. And yeah, and we'll have, like I said, the polka band, and we're going to have brats and sauerkraut, and it's going to be a good time.
And that's what you said it's all about, is making those special moments and allowing them to kind of pull from their past, you know, brings back memories for them.
Oh, absolutely. You know, just because you have dementia and because you may have some deficits doesn't mean that you are not in there. And so we have to find what it is that's going to let you come through past that cloud. And we do that very well here at Erwin.
And I know too, you've been around for many, many years, but you have some exciting things happening down the road.
Absolutely. We have a dementia expansion that we're going to be doing here at Erwin, which is not only a physical expansion of the facility. The physical expansion will give us an enclosed courtyard, so my dementia residents will be able to go out of the courtyard at their choosing.
Nice.
We will have some like gazebo and some other sitting areas where they can go out and enjoy the wonderful Tennessee weather when it is wonderful, not raining or, you know. And then also some programming expansions. So for one of the things that we're starting here before the actual physical expansion is we're going to move to 2-hour windows for dining. So we normally serve breakfast at 7. However, we're moving to a schedule where anytime between 6 a.m. and 8 a.m., if you come down to the dining room, you can get breakfast. So if you want to get up at 6 today and you want to wake up at 8 tomorrow, you can still get a hot breakfast. The same thing with lunch, 11 to 1, same thing with dinner, 4 to 6.
It sounds like you've really done patient-centered care. Like, what do our residents need? What can we give them that will make them feel more comfortable, make it feel more home?
Absolutely. This is their home. And so we, being visitors to their home, should accommodate to them. And so we take every opportunity to try and elicit what it is that the residents want, because some of my residents are not capable of verbalizing specifically what they want. So that's a little bit of a a guessing game that we kind of go through. Is it this? Is it this? Is it this? But we will never stop trying to get that information and to provide that ability and that service for the residents. I think another thing, strength we have here at Erwin is the longevity of the staff. I have staff who have worked in this building 15, 20 years. And so they are your friends, they are your neighbors, they are the people that you meet at the grocery store, and they're taking care of the lady that lived next door to them when they were growing up, or the guy across the street used to say, hey, get off my lawn. Well, now they're taking care of him. And you know, that just adds to the sense of community and home here at Erwin.
Well, thank you for having us out. We're going to give everybody some information. If you would like to learn more, they've got a great website. You can come by, you can tour. Here is the information. You can find them at erwinhealthcare.net. That's erwinhealthcare.net.
The preceding segment sponsored by Erwin Health Care Center.